Hello again. Welcome to this month's CNA Continuing Education. This month we're going to talk about diabetes. We'll talk about a few different things like the difference between type 1 and type 2 diabetes, the relationship between glucose and insulin, and the signs and symptoms of blood sugar that's too low or too high, and then we'll talk about some important aspects of caring for a person who has diabetes. So we'll start off with the two main types of diabetes. There's type 1 diabetes, where the pancreas produces no insulin or very little insulin. This one is usually diagnosed in childhood, and the person will have this for their entire life. Type 2 diabetes is one that happens over time. The body does produce insulin, but the pancreas can't use it effectively to control blood glucose. So let's talk about glucose and insulin and kind of how they interact. Glucose is one of the most important fuels that the body burns for energy. Just like a car uses gasoline to run, your body uses glucose as a fuel to run all of your body functions. The way that your body gets glucose is by breaking down the foods that you eat. And the easiest source of glucose for your body is carbohydrates. So that's things like breads and fruits, starchy vegetables like potatoes. Those are all sources of glucose for the body. The way that insulin works is insulin actually transports the glucose molecules into the cells so that the glucose can be burned for energy. You can think of insulin almost giving glucose a piggyback ride into the cells so that the glucose can be used to run your body. So in both types of diabetes, the body has this deficiency or this lack of the hormone insulin. And then insulin is the one that gives glucose that piggyback ride into the cells of the body where the body can use that glucose for energy. So in a person with diabetes, their blood sugar levels are elevated because they don't have enough insulin to piggyback that glucose into their cells where they can actually use it for energy. So let's talk about glucose in the brain. Your brain relies on a steady supply of glucose to run your entire body. So if blood sugar is too low, it can actually damage brain tissue, or the brain may actually shut down altogether. Kind of like a car without gasoline, it can't run. Without glucose, your brain can't run. So over time, blood sugar that's too high for too long can cause chronic health problems. That means long-lasting health problems. Over time, that uncontrolled high blood sugar can actually cause damage to organs like the kidneys, the lungs, the eyes can be affected. Diabetes is one of those disease processes that can actually affect the whole body over time. Let's talk about some symptoms of blood sugar that's too low or blood sugar that's too high, so that these are things you can watch for in your residents with diabetes. So we'll start with blood sugar that's dangerously low, and that's called hypoglycemia. So remember, the brain relies on that glucose for energy, kind of like the car relies on gas to go. So when there isn't enough glucose, the brain isn't functioning appropriately. So ways that that's going to show up, somebody with low blood sugar may be suddenly confused. They may be anxious or have a fast heartbeat. They can experience weakness, or they'll break out in a cold sweat, or they may have a tremor. They may shake. Those are all signs of blood sugar that's dangerously low. The opposite of that, of course, is blood sugar that is too high, and that's called hyperglycemia. Signs and symptoms of blood sugar that is too high. The person is typically very, very thirsty, and it doesn't matter how much we give them to drink. It's just not enough. Along with that drinking the extra fluids comes increased urination or increased trips to the bathroom. Skin that feels really warm to the touch. If their cheeks are flushed and their skin feels really warm, they may also have high blood sugar if they're diabetic. An easy way to remember the symptoms of low or high blood sugar is that if they're cold and clammy, they need some candy. So if they break out in a cold sweat or they feel cool to the touch, their blood sugar may be too low, so they need some candy. So cold and clammy, they need some candy. And if they're hot and dry, then their sugar is high. So if they're extremely warm to the touch, they're dry and they want more and more to drink, then their blood sugar may be too high. So cold and clammy, they need some candy. Hot and dry, their sugar's high. So, caring for the resident with diabetes, we're going to talk about kind of the 3 M's for caring for the resident with diabetes. Those are meals, motion, and monitoring. These are the 3 big chunks of caring for someone with diabetes. Let's start with meals. Offer that person regular meals and snacks. Don't let them go a long time without eating. Even if they refuse to eat, if it's on their diet plan, you may offer something like a Glucerna or an Ensure, depending on what they can have, but try not to let them go too long without getting some kind of something to eat or drink. Follow their diet plans exactly. So in diabetes, something as simple as adding an extra scoop of mashed potatoes to somebody's plate can cause dangerously abnormal blood sugar values. And then concentrated sweets. These are things like desserts, candy, juices. Those are things that should either be closely monitored or even avoided altogether in someone with unstable blood sugar. Let's talk about motion. Regular movement and activity is so good for the body. We are made to move. It does things like it lowers our blood pressure. It can lower anxiety and those behaviors that are related to anxiety. It can lower cholesterol. It can strengthen muscles and bones. It can prevent muscle atrophy and contractures. Muscle atrophy is the wasting away of muscle tissue from lack of use. And then contractures are those permanent, painful shortening of muscles or tendons, and exercise can actually prevent both of those. The other thing that regular movement and activity can do is help control blood sugar. So really important that we encourage the resident with diabetes to participate in appropriate exercise and appropriate movement that they can do. And then let's talk about monitoring. So the CNA who is caring for that resident with diabetes has such an important role to monitor for those complications of diabetes that can pop up. Y'all know our people so well, so you catch those unusual symptoms that maybe somebody else wouldn't catch. Anything that's unusual for your resident needs to be reported to the nurse immediately, but especially for your residents with diabetes. And then common signs or symptoms, things that you can watch for in your residents with diabetes. If you notice blurred vision or vision changes, you notice that maybe over time they gradually sit closer and closer to the TV, we may need to get their eyes checked for diabetic eye changes. Dizziness or clumsiness that's not normal for them. They may be experiencing some blood sugar issues. Numbness or tingling in their extremities. They may also not have the same pain sensations in the extremities as someone without diabetes. So they may stub their toe and not feel that associated pain. And then, of course, if you have any kind of confusion that comes on all of a sudden, or weakness or difficulty breathing, those always need to be reported to the nurse as well. Because people with diabetes can have an altered pain sensation, it's possible for them to experience really serious health complications without the typical signs and symptoms that we would associate. So they could have serious wounds on their feet or on other parts of their body, but not feel the pain that's associated with those wounds. So we need to check their skin really frequently to make sure that we catch those wounds when they're small. No matter how small in someone with diabetes, any kind of wound needs to be reported to the nurse. The other thing that can happen in diabetes is they may experience things like a heart attack without severe chest pain because they have that altered pain sensation. It's possible for them to have a heart attack but only complain of an upset stomach, or maybe even just break out in sweat or be anxious because they don't have the associated chest pain. So anything that's unusual for your resident needs to be reported to the nurse immediately. If you notice any kind of confusion that comes on all of a sudden, vision changes, numbness, tingling, clumsiness, or even small wounds, we need to be checking the skin of our residents every time they're bathed, dressed, changed, or repositioned. Those are all great times to look at their skin so we catch those wounds when they're small and prevent them from getting any bigger. You also want to assist your resident to follow a lifestyle that includes that regular exercise that's so important for the body, weight control, and following those special diets exactly. Because when we don't carefully control their diabetes, it can cause pretty serious health problems like kidney failure, heart disease. It can even lead to blindness, or those wounds on their extremities can lead to amputation if they don't heal. And finally, we appreciate you. You catch the little things before they become big things. And you know our residents so well. You are the first one to realize when something is not right. We rely really heavily on you to be our eyes and ears, and you are amazing. Thank you so much for helping us take care of our sweet people. All right, we'll see you next month for another continuing education hour. Thanks.